The second problem with it is it ties us even more tightly into an employer-based healthcare system. I think there's a lot of problems with an employer-based healthcare system. I mean, really, what sense does it make? You know, why should you get your health insurance at work? You don't get your auto insurance at work, or your homeowner's insurance policy there, or your life insurance policy at work. Why get your health insurance there? You know, if you actually think about it, I mean, it's actually kind of an historical accident. It comes out of World War II. In World War II, you had two problems simultaneously. Number one, you had a labor shortage because the guys were over at the front. And number two, you had wage price controls. So employers couldn't compete for the available workers on the basis of raising wages. So what they did was they got around that by offering fringe benefits like health insurance. And then the IRS came along in 1951 and said that's a tax-free benefit. So essentially what it means, if you get paid wages, you have to pay taxes on it. If you get paid health insurance, it's tax-free. So there's an incentive for workers to substitute insurance for wages. Now look at it this way. If an employer was paying someone $50,000 a year and giving them a $10,000 insurance policy, as far as the employer is concerned, he's paying them $60,000. But as far as the worker is concerned, he's paying taxes on $50,000, not $60,000. But if the same employer were to turn around and say, look, instead of giving you insurance, I'm going to give you $60,000 in cash, and you go out and buy your own insurance policy, he'd have to pay taxes on all $60,000, which means that he would end up losing money on the deal. He would be worse off. So the incentive is to keep getting that work. But what does that mean? It means, number one, your boss gets to pick your insurance for you. You know, you might want to see a particular doctor, and your boss says, you know, to save money this year, I'm going with this new HMO. Your doctor's not part of it. Too bad, you're out of luck. You don't have any say in it. And second, it means if you lose your job, you lose your insurance. You lose your job, you don't lose your auto insurance policy. You do lose your health insurance policy. But this employer mandate ties us even more tightly into that employer-based system, and I think that's just the wrong way to go. Second, beyond the mandates, there's going to be subsidies, because you can't very well require people to buy health insurance if they can't afford it. So there's going to be subsidies. The level of subsidy varies in the bills. Up to the House bill, it's up to 400% of the poverty level, which would be $88,000 for a family of four. The Senate side is only 300% of the poverty level, about $66,000 for a family of four. But there will be some sort of subsidies in the expansion of Medicaid as well. Particularly, they want single men to be brought in. Single childless men, which are not eligible for Medicaid in most states now, would be made eligible for Medicaid under these programs. There will be something called an exchange. Now, exchange, this is a really radical concept. And I have to say, we don't think there's innovative thinkers in Congress. Imagine this concept. They're going to create a place where buyers and sellers can come together. And the buyers will have money, and they'll give it to the sellers, and the sellers will give them a product. Think of that innovation. How, what did we ever do before this came up? In all seriousness, what it is supposed to be like a giant e-insurance. You're supposed to be able to go online, and all the insurance products will print out and be easier to compare. I think it's essentially harmless, but that's essentially going to be part of the bill. And there will also be, those are sort of the key ingredients that you're going to find in all the bills put together. But that leaves a lot of questions, I think, in terms of what the bills are going to do. So let me see if I can answer a couple of the ones that are most commonly asked. First of these is, if you have health insurance today and you like it, can you keep it? Now, this is something that they talk about a lot. The president hardly ever gives a talk without saying that if you have health insurance and you like it, you can keep it. Talk about a lot. The short answer to that is, no, you can't. And let me give you 4 ways in which you won't be able to keep that insurance. The first is this individual mandate and employer mandate. They essentially work the same way. You might think, if I have insurance today, it doesn't affect me. this is a mandate that people have to go out and buy insurance. Well, I already have health insurance. Not going to make any difference to me. Well, no, it will. Because remember I said it's not just a mandate that you buy insurance. It's a mandate that you buy a specific package of benefits. And there's a reason for this. You know, if you're going to have a mandate to buy insurance, you have to say what is insurance. Now, I'm pretty sure my $1 million deductible doesn't qualify. So what they did is they set out a whole list of requirements. It can only have a deductible of so much. It can only have lifetime caps of so much. It can only have out-of-pocket expenditures of so much. And it has to include all sorts of specific benefits. It has to include dental care and vision care, drug and alcohol rehabilitation therapy, mental health benefits, and even Christian Science practitioners are included in the House bill that have to be covered under this. So all of these things have to be included. And if that's not enough, they actually also create a commission headed by the Surgeon General, which will come up with additional benefits that will have to be included in the plan you buy. So if you have health insurance today, and it doesn't meet those requirements, say your current plan doesn't cover, I don't know, drug and alcohol therapy, rehabilitation therapy, you will have to drop your current plan and get one that includes those benefits, even if it's a more expensive plan, because those benefits don't come for free. They add, in fact, drug and alcohol rehabilitation adds about 10% to the cost of an insurance policy. So you will have to buy that more expensive plan. And it works this way: if you get employer-provided insurance, and about 70% of Americans get their health insurance at work, employers have 5 years of transition before all their plans have to meet the new requirements. So after 5 years, they will have to switch all their currently insured people to a new plan that includes all these new benefits and requirements the government sets. If you have an individual plan, you're grandfathered in. If you bought your insurance on your own, you don't have to change your plan unless you make any change whatsoever to your plan. So if, for example, you get married and you want to add a spouse, or if you have a child, or if you want to change any benefit in your plan, then you must get a plan that meets all the government's requirements for what that plan is. So that's way number one in which you may not be able to keep your plan. Second, there's a group of plans out there called health savings accounts, which you may or may not be familiar with, which is a way of getting around that tax problem. It basically allows you to buy a high deductible insurance plan and then have a tax-free saving plan to pay the deductible underneath it. Those are basically eliminated under the bills. So about 10 million Americans have those. They would be gone. Third, people in the Medicare Advantage program, which is seniors. About 1 out of every 5 seniors is in Medicare Advantage, which is essentially the government pays private insurance plans to provide Medicare benefits to seniors. Those plans provide benefits over and above traditional Medicare. Generally, they provide prescription drug coverage without the donut hole that exists under the Medicare prescription drug benefit. They offer vision care, dental care, some other private surgical services, things of that nature that traditional Medicare doesn't cover. Basically, in order to get those extra benefits, the government right now provides additional subsidies to the insurance companies to provide those plans. They're going to eliminate the extra subsidies to the insurance companies, which may or may not be a good thing, but the insurance companies have been pretty straightforward about saying that if you take away the subsidies, they're not going to stop offering the plans. So therefore, those 1 in 5 seniors will have to leave Medicare Advantage and go back into traditional Medicare.